ના જાણનાર છે જે આપનાથી નથી જોવાતું કે આ એક પ્રોબ્લેમ છે આ જોઈ રહ્યા છે અને આવી રીતે ફરમાવી રહ્યા છે અને આપને જગાવી રહ્યા છે કે આના પર હરકત કરો તો શુક્ર से शुरू करिए છે मौलाना आपकी उम्र शरीफ ने खुदा ताला का रोज़े क़यामत दराज ने दराज आमीन आपने शुरू करी के निकोटीन શું છે ને પછી આપણે જે કુસુરના સાથે જંબાયેલું છે આ તો દરગુજર કરજો Nicotine से शुरू करिए અને પછી e-cigarettes पर थोड़ी जिक्र करिए I might go between Gujarati Zaban and English so nicotine एक stimulant भी છે અને એક depressant भी છે અને આ સગળી ચીજો addictive છે અને નશા લાવે છે અને addiction થાય છે and that's what's most dangerous about it જ્યારે nicotine લો છે whether it be through many things such as cigarettes cigars chewing tobacco, snuff છે જે ઘણા આમ નીચે મૂકે છે જેમ કાટ છે એટલે snuff છે અને આ vapes જે કહે છે e-cigarettes એ સગલું what happens is it stimulates in the brain dopamine and it gives you kind of a high but it gives you a very transient high and then that you come down from that and when you come down from that you want that high again and that's one of the bases for the addictive properties of nicotine. The other thing is it's also a depressant, so it releases beta endorphins, and that inhibits pain. So that kind of gives you a down. It's like a little bit of a downer, and it can cause, and we'll see later, it can cause things like depression and things. So it decreases your mood, it decreases your appetite, and it leads again to dependence. Toxic gases released થાય છે, especially smoking cigarettes, but even smoking the e-cigarettes. અને એને vapes કહેવાય છે. So some of the short-term effects, if you're a casual smoker હોય, social smoker, they might get these kinds of, I mean, સગલું નહીં વાંચું, I'll let you guys, everyone, સગલા જોઈ બી લઈ કેમ કે time ના હિસાબથી. But you can see there's dizziness and headaches, etc. Regular smokers, so they have other symptoms that they might feel. So they may get, you can see there's some contradictory stuff here, relaxation and mild stimulation, because it has both properties. And like reduced appetite, cramps, vomiting, so there's a whole host of symptoms. There's long-term effects, and obviously Mola Sablu jane not only ajnu but kalnu ne akhiratnu. But you can see there's long-term effects. If you smoking while pregnant, you're gonna, there's chances for birth defects. Strokes, coronary artery disease, aortic aneurysm. Aortic aneurysm is apnu je aorta che fuli jay, and if fuli jay it could burst, so you could die essentially. Strokes and coronary artery disease, heart attacks, basically because plaque form થાય છે બધા arteriesમાં અને heart attack is a occlusion of the arteries of the heart. Even the stroke is an occlusion of the arteries of the brain. So આ સગલી ચીજો થઈ શકે છે. Dysfunction, sexual dysfunction, because again blood vessels ના ઉપર અસર થાય છે, and then these are a lot of the different things. And then there's a whole host of cancers that are caused that have a causal relationship with nicotine. And you can see the list there. Essentially, it's almost everything that you can think of here. So e-cigarettes શું છે? એક electronic device છે, જેમાં liquid હોય છે, અને પછી એ liquidને aerosolize કરવામાં આવે છે. So there's a battery component, there's a heating element, and then there's a liquid storage within it. So that liquid is heated, forms a vapor, gas, and then you breathe in the gas and you breathe out gas. And the dangerous thing is that these look like everyday items. These look like flash drives, they look like pens, and that's the scary part, because bachao su e loko paase che apne घनी बार खबर नहीं होती. You know, we don't know. I mean, we see flash drives all the time now. It's just something to be aware of. અને ઘણી ચીજો સી નામ સી કહેવામાં આવે છે. And એમાં એક substance છે glycerin જે has been shown to be harmful. There's many different types, but you know, and you can see the component there. Battery છે, પછી એક chamber છે જેમાં liquid છે અને પછી એક ignition થાય છે અને એનાથી vapors થાય છે. Second-hand smoke bhi hoy, because just like smoking, there's second-hand effects as well. So, you know, if you're hanging out with people who are doing these, you're at risk as well, just like you would be for cigarettes. Cigarettes no zamano is kind of gone, like in this country at least. I mean, biji baju world ma cigarettes is still pretty prevalent. US ma it's died down significantly because of the campaign against cancer, but now this has taken over. You know. And ama biji chijo bhi malavi sako che. So you can put marijuana in here. You can put a combination of the two. You can do a lot of things with this. So it's pretty dangerous. There's one specific thing called Juul, which is kind of one of the worst. And because it looks like a flash drive, and it has very high levels of nicotine, and some say as much as 20 regular cigarettes in one. So you can imagine, I mean, that's like a whole pack of cigarettes. Exactly, but they use something called nicotine salts, which allows this high level of nicotine, and it's apparently easier to take on the body, and so people do it more easily. But this is something to watch out for. I think this is a Juul. You can see it looks like a flash drive. I mean, you know, obviously it's unsafe for bachao, right? And although sometimes they advertise these as with no nicotine, but they all have nicotine. I mean, they may be a janabe zikr ki di ke it might be 0.1%, but they have it. And that's the whole point of it. They want you to get hooked on it, because now you're not hooked on cigarettes, so they need to find something else for you to get hooked on to make money. So they're going to get kids hooked on this. It obviously developmentally it harms adolescent brain. It causes learning disabilities, attention deficits, mood disorders, impulse control, A to Z, and it's probably a big reason why there's so much havoc in schools nowadays, because kids are doing these things people don't know, and you wonder why somebody's mood is fluctuating or they're behaving the way they are. This may be a reason. So dependence ની વાત કીધી. Withdrawal થાય છે, obviously કઈના ઉપર dependence થાય તો પછી if you take it away, withdrawal થાય, and you have these kinds of systemic systems of irritability, restlessness, anxiousness, depression, sleeping problems, and cravings for nicotine. And ironically, some people may say, well, मैं smoke करूँ तो it relaxes me, but it's doing the opposite. It's causing more anxiety and stress. So although they're trying to deal with stress and anxiety, they're actually causing stress and anxiety. So school, obviously, it's a big issue, and a friend circle. So it's incumbent on parents to know who their kids are hanging out with. I mean, I think it starts with simple things like that. It's very easy. Okay, they went to somebody's house and they came back, but it does help to know where your kids are going and things like that. And I'll show you. So this is just kind of aerosolization, that it's not a harmless vapor, as are some myths. That it has particles, it has these things that cause lung disease, emphysema, bronchiolitis, all kinds of things, and I'll show you a few examples of a couple. It has heavy metals in it, so it's just toxic, all around. And you can get secondhand smoke effects from it. The reference for most of this was the CDC website, just FYI सगळं असं. And this was a paper in radiology that showed, so je left now per chair, that's a normal healthy lung. And je kalu je che, that's basically air in the lungs. Okay? Have vachma joso, so that's somebody, it's like a 30-year-old who was vaping. And you can see that there's all this white where the black should be in the lungs. And that basically means that your alveoli che, circles che, that makes up your lung, where the air goes, is filled with something. And that something is usually edema fluid, so it causes basically pulmonary edema. It can cause hemorrhage. This could be hemorrhage. You can't tell from this x-ray, but it could be hemorrhage. It can cause pulmonary hemorrhage, or it can cause something called ARDS, which is respiratory distress syndrome. And these, you can end up being ventilated. There have been many cases in the radiology and medical literature where vaping has caused major problems in the lungs. This one on the right is, not necessarily the same patient, but a 37-year-old who vapes for a long time, and you can see all kinds. This is a CT scan. It's a coronal CT scan, but it looks very similar to the X-ray. And you can see all that white is abnormal. That big hole in the right lung is abnormal. There's a pneumothorax, meaning that the lung is collapsed on the right side. The airways are inflamed, they're large. There's a multitude of problems that happen from this vaping. So it's not a benign thing. A couple of things, we're educating ourselves. Maulana Ishaq Munir Mutabik, we're educating ourselves. Talk to your bachao સાથે વાત કરો કે મદ્રસામાં ઇન્શાલ્લાહ આ પ્રેઝન્ટેશન થાય અને બચ્ચાઓને બી અવેર થાય કે આ શું છે. Because જ્યારે એ જોઈ કોઈના પાસે તો એને ખબર હોય કે this is bad, and that's it. That's the end of it, right? They know that for certain things, but they don't know it for this. So it's just joy. That's just mehnat ki, ama mehnat ki. Boundaries, apne role model obviously bane bachao waste. Monitor behavior, meaning ka jai che kona sathe rame che sagli apne khabar hoy. And you can keep out, for signs of this, sweat, smells, janabe, it has a lot of flavors, and it has different, nice tasting flavors, etc. So that's something you can smell on breath, etc. Healthy activities, and then obviously you should seek help, But in પાછું શુકર સી એન્ડ કરીએ કે મોલાનો શુકર કે આવી રીતે આપણે ગાઈડન્સ આપે છે, આપણે આના ઉપર આપણી આંખ ખોલે છે કે આ છે પ્રોબ્લેમ, અને તમે સગલા હરકત કરીને એનો ઇલાજ કરો આપણા જાન વાસ્તે, આપણા जिस्म वास्ते, अपना आखिरत वास्ते. तो खुदा ताला आपसे नाले कदम वालानी उम्र शरीफ तारो से क़यामत दराज कर जो. आपका ठंडा सहमा अपने सगला मुमिनीन आबाद शाद रखजो, અને હર કિસ્મ ના મુહારમાત થી अपने सगला ने बचाओ.